Today, we're going to get into something really fascinating, a 2015 research paper that takes a close look at a surgical technique for fixing a narrow upper jaw. We'll explore exactly how the procedure is done, how they measured if it actually worked, and, of course, what the results tell us about this pretty innovative approach.
All right, so here's our game plan. First, we need to understand the problem itself, right? A narrow upper jaw. Then, we'll dive into the cool, bone-borne surgical solution they put to the test. After that, we'll get into the nitty-gritty of the study's design, check out the actual numbers, and finally, wrap up with the big conclusions the researchers came to.
So what are we dealing with here? The condition is called transverse maxillary hypoplasia. It's a bit of a mouthful, but all it really means is that the upper jaw is too narrow for the lower jaw. And, this is more than just a cosmetic thing. It can cause real issues with chewing, bite alignment, and sometimes even breathing. So yeah, finding a solid, effective treatment is a pretty big deal.
So the big question is, how do you fix a jaw that's too narrow? Surgeons have a few tricks up their sleeve, but this paper focuses on one specific technique, a surgically assisted expansion that uses a device anchored directly to the bone itself, not the teeth.
Now, before we jump into the new method, it's really important to know why it was even developed. You see, the traditional expanders usually hook onto the teeth. This can cause all sorts of problems, like damaging the teeth or the gums, and sometimes after all that, the jaw just shrinks back over time. So the whole idea behind this bone-borne device was to just bypass the teeth completely, apply the force straight to the bone for a much more stable and predictable result. Okay, so let's walk through the surgery itself. It all starts inside the mouth. If you look at that first image, panel A, you can see the surgeon making this T-shaped cut in the roof of the mouth. That's the palate, to get to the maxillary bone sitting right underneath. Next up, we have what's called an osteotomy. It's just the medical term for cutting a bone. In panel B, you can see that cut happening right along the side wall of the maxilla. This is just one of a series of really precise cuts they have to make to free up the upper jaw. Now, this next step you see in panel C, this might just be the most important part of the entire operation. This is the midline osteotomy. The surgeon carefully separates the maxilla right down the middle. This split is what makes the whole widening process possible. And here we go. Panel D shows the final step of the surgery. That little device is the expansion device, or distractor, and it gets mounted with tiny screws right onto the two halves of the bone. Once that's in place, the operation is done. Now the patient starts the real work. So, how does the jaw actually get wider? Well, here's the crazy part. The patient does it themselves. They use a small key to turn a screw on the device. The paper describes it perfectly. It's unscrewed like a bottle screw. It's this simple motion that gradually pushes the two halves of the jaw apart, usually by about 0.5 millimeter to 1 millimeter each day. Okay, so we've seen the procedure, which is pretty clever. But how did the researchers actually figure out if it worked? How did they measure success? Let's get into how they designed their study. Right, so this was a retrospective analysis. That just means they looked back at the records of 27 patients who had already gone through the procedure. The group was made up of 9 women and 18 men, all between 17 and 26 years old. And here's the key. Every single one of them had a pretty significant jaw narrowing. We're talking more than 5 millimeters. Now, to track the changes, these researchers were incredibly thorough. They took measurements at 2 key moments: before the surgery, which they called T1, and then 3 months after the expansion was all done, which they called T2. And they didn't just use one method, they used 2. They made physical dental casts to measure tooth movement and took detailed x-rays to see the actual skeletal changes. Their whole protocol was just meticulous. They made the casts, they marked these super specific points on the tips of the canines, premolars, and molars, and then they measured the distances before and after. And they did the same thing on the x-rays, measuring not just distances between bones, but also how key angles changed. This dual approach really gave them a complete picture of everything that was happening, both with the teeth and the skeleton. All right, this brings us to the real heart of the paper, the results. So after all that careful measuring, what did they find? Did the whole thing actually work? Let's look at the numbers. The results were honestly pretty stunning. At the first premolars, they found an average expansion of 7.3 millimeters. That is a major clinical correction. But what's really fascinating is that the benefits went beyond just the jaw. The base of the nasal cavity, the airway,
widened by an average of almost 3 millimeters. I mean, think about it. That can have a huge positive impact on how well a patient can breathe. And they also measured a skeletal shift of almost 4 degrees in the molars. Now, that might not sound like a lot, but this is a huge deal. Why? Because it proves that this was a true parallel movement of the bone itself. It wasn't just the teeth tipping outwards. This bar chart really gives you a clear visual of that change in the nasal airway we were just talking about. You can see the average width shot up from about 29 millimeters before the treatment to nearly 32 millimeters after. That's a statistically significant increase, and it shows this amazing positive side effect of the procedure. And when you look at the data from the dental cast, you see this consistent, significant expansion all the way across the arch, about 5.8 millimeters at the canines, 7.3 at the premolars, and 6.1 at the molars. The expansion was a success, and it was really well distributed from the front to the back. So we've seen a lot of numbers. What does it all really mean? What's the bottom line here? Let's break down the study's main conclusions. The researchers' conclusions are really clear and to the point. First, they confirmed that yes, this surgical technique using a bone-borne device is an effective way to treat maxillary hypoplasia. Second, they highlight that bonus benefit of widening the nasal cavity. And finally, they point out a really important practical detail. The device was actually easy for patients to use themselves at home. Ultimately, this paper gives some seriously strong evidence for the bone-borne approach. By anchoring directly to the maxilla, surgeons can get significant, stable skeletal expansion. And this avoids putting all that stress on the teeth, which in turn helps prevent a lot of the complications and relapses that you'd see with the older tooth-borne methods.
You know, seeing how well this distraction osteogenesis works on the maxilla, it naturally leads to a bigger question. It really makes you wonder, where else could this principle of gradual bone-borne expansion be used? Could we use it to reshape and correct other complex skeletal problems in the face and skull? That's definitely something to think about.